Namaste and welcome back to this series on breast reduction. Now that we have already seen the markings used in Weiss pattern inferior pedicle type of reduction technique, what is the next step? So how are we going to proceed in the surgery and what are the steps of it? Because that gets also confusing initially when you are not used to seeing these surgeries often. So first of all, after the patient in proper position, a tourniquet is tied around the base of the breast to reduce the amount of bleeding during surgery. And also infiltration is done in the surrounding areas of the breast except for the pedicle area, again to help in the vasoconstriction and reducing the blood loss. So now that we know the markings, what is going to be the first step of this surgery? So this is the marking of the Weiss pattern and this is of the inferior pedicle. So now in the first video I said that usually this is around 8 centimeters of breadth because this is for the typical standard measurements that we have seen. A lot of centers prefer to use the inferior pedicle technique even when the distance of this is very far from the inframammary fold, which means even if the inferior pedicle is very long, some papers have also described up to 25 to 30 centimeters long, they still use this technique and they say it gives good results without hampering the vascularity of the nipple areola complex. But in that case, obviously, the breadth cannot be 8 centimeters because it won't sustain that pedicle. So we know the rule of 1:1 in plastic surgery, which we use for random pattern flaps. But for these sort of pedicle flaps, a ratio of 1:2 to a maximum of 1:3 can also be retained when we plan this inferior pedicle technique in cases of very large breasts. Okay, so now the first thing that we are going to do is that suppose this is the entire breadth of the nipple areola complex. We know that we want to keep our NAC to a width of about 38 to 42 millimeters. That's around 4 centimeters, again with standard measurements. So first, by placing a cookie cutter on the NAC area, we are going to outline that this is what we are going to keep. The rest of it is going to be de-epithelialized along with the pedicle. Now it is always a good idea to first outline, that is incise all your markings, because once you start the surgery and the bleeding occurs and the markings get washed off, it becomes very difficult to assess your landmarks. So it's always good to just give a light incision or tattoo all these important points. Okay, now the next thing that we are going to do after the cookie cutter is that we are going to de-epithelialize the rest of this pedicle. So we're just going to remove the epithelium from this entire region. This is the small tongue-shaped flap that we have kept in the base for the T-junction. The rest of it, either with the help of a blade or with the help of scissors, is removed. Even the excess part of the areola is de-epithelialized along with that of the pedicle. So now our pedicle de-epithelialization is done. Now we are going to incise the borders, deepen them along the edges with the help of a cautery to help elevate this pedicle, that means isolate this pedicle. Initially it was thought that the pedicle needs to be full thickness, that means down to the pectoral fascia, but now studies have shown that a good amount of pedicle without being very thick is also shown to have good vascularity. As thin as a subdermal plexus also gives the good amount of venous return for this pedicle, but we always choose to keep some amount of fat in it as well, because this is also going to form the bulk of the breast for us. So imagine that this is your pedicle, you have incised it all around, and now you are going to elevate your pedicle, and you have the remaining tissue below it. So we have the pedicle with us. Now what are we going to do? So in reduction mammoplasty, it is a good point to note that it is more important as to what you keep rather than what you discard. So after you've decided the size of the breast, you ascertain the amount of tissue that you want to keep, and the remaining amount of tissue is what is going to be discarded. So imagine that from the medial and lateral side as well as a little bit superiorly, this is all the amount of tissue that you are going to want to discard. So that is that you will create the medial pillars and the lateral pillars by keeping the amount of tissue you want, and the rest of it will all be discarded. So now we have with us the amount of tissue that we want, and we have the pedicle. Now we are going to reposition this nipple areolar complex to this level, and it is going to be anchored to the pectoralis fascia with the help of a non-absorbable suture to prevent its descent with gravity. So this is what we do initially. Okay, so now imagine that you have your pedicle, you have created the medial lateral pillars, and you have completed all your incisions. Now what you have done is that you have raised these flaps of the skin along with some amount of tissue. Now how is this going to unite? So we know that we are looking at the union of these 3 points basically, which is going to help with the closure. So once these flaps are elevated, they are then made into a cone-like fashion. Once you join them, you yourself will realize that they form a sort of a cone when you see this tissue from the medial side or with the lateral side. So this cone will be persisting once you join these 3 points. That is how you're going to get a T-shaped closure also in the case of Weiss pattern. Here you can see that you will find a projecting part, and this is where your nipple areolar complex will come out. Because what happens in case of the Weiss pattern technique is that your pedicle is here and you have brought the flaps over it. So your pedicle is going to get buried. So you have to then create another circumference of around 4 cm centered on this area. You will de-epithelialize that area again, and then eventually the nipple areolar complex will come out from there. So your NAC has been brought out at this point of projection, which is going to be the prominent part or the projecting part of the cone shape that we have created now, and the rest of the de-epithelialized pedicle has been buried under these skin flaps, and this is where the 3 flaps will unite, giving it a inverted T-shaped closure. So finally, to quickly revise what are the steps of this surgery: first, mark out the nipple areolar complex, outline all your incisions so that you don't lose your landmarks, de-epithelialize the pedicle, create the medial and the lateral pillars, reposition the nipple areolar complex and anchor it to the fascia, join the elevated flaps at the T point, and then ultimately mark the outline, bring out the nipple areolar complex. After that, minor adjustments of the excess skin tissue or the dog ears can be done, and finally the closure is completed most of the times with over a suction drain.